facing you, you have your maxillary molars, your anterior molars, maxillary, and you have one anterior, which you should have three, but in this doctor, this was an older doctor who was in the practice before Dr. Cutler, and when he bought all the records and everything, we took all of this out. So this is why we have these x-rays. So there should be two more anteriors and 2 more bite wings to make the complete set, which is 18 in most offices. On the test, it's 20, okay, because there's 4 in the maxillary, and then there's the extra distal. You can have a distal molar exposure also. So 20 is the answer for the test, but in practice, it's generally 18. Okay, so we have, you can see how they're set up. The bite wings are in the middle. Okay, you want to make sure that your mount is labeled with the patient's name and any other pertinent information that's required by your office. If you have a multi-doctor office, you definitely will want to put the doctor's name on it. You put the name, the date, doctor's name. What other information might go on it? I don't know. That's probably about it. But you need to make sure that your information is on the mount, because that's how you keep your x-rays straightened out. The most challenging part of mounting radiographs is arranging them correctly. And there's a little trick to help you to do that. And we're gonna talk about that here in a minute. Okay, we're gonna make sure, next page, number 1, we're gonna make sure, we went backwards instead of forward. We're gonna make sure that our hands are clean and dry before we handle the radiographs. To prevent smudging, how are we gonna handle them so we don't get fingerprints on them? By the edges, remember? By the edges, always by the edges. On the margins only. For each film, we're gonna feel for that embossed dot, and we're gonna place the film on the view box so that the convex side faces up and the concave faces down. So you're gonna go ahead and arrange them on your view box, or on your paper towel, or on, however. This view box stands up. It's hard to place them up in the air. But on this one that they're demonstrating, it's a view box that lays down, and you can just lay them down that way. But we're gonna feel for the embossed, the dot is it's used for mounting. That's what it's for, is for mounting. We're gonna arrange the radiographs with the maxillary teeth on the top. Why? Because the maxillary teeth are on the top, okay? It is the simplest answer, actually.